Good afternoon, everybody. Here from my quarantine at home. We're all in good shape. Everybody is tested. Well, unfortunately, one member of my security detail did test positive. Was not in close contact there, but let's continue to err on the side of safety. Here with Josh and Paul and Ellen Sapo-Sasu, maybe you know is the great mayor of Bristol, and Michelle Siegel, Consumer Protection. They're here because in a minute they'll have a chance to talk about some of the protocols we have in place to keep you safe and how they're being enforced. That's where the rubber meets the road. Let me first talk about the COVID daily summary, Max.
Here's the problem. It's going to come up
disturbing numbers here, but a continuing a trend.
Oh, you know what?
Just the beginning.
Somebody better go on mute.
Please mute.
What you see here, first of all, is a 6.5% positivity. It's about 5.8 over the last 7 days. What that tells you is we continue to creep up. And it's based upon 36,000 tests. So obviously we're testing a lot more than we ever have before. I know there are now lines for people to get tested. During the summer, there were no lines because we were a little perhaps more relaxed. Now we're back on our wits and to know how important this is. That said, we're doing everything we can to ramp up our testing. We've added from 200 to 260 testing sites, 60 additional testing sites just in the last couple of weeks, I think that is. So did everything we can to make it easier for you to test. And we'll talk about some of the things we're doing in our schools in a minute. Current hospitalizations are up. This is a one-day number. And fatalities. I hate to dwell on this. But a lot of people think, oh boy, this time around, it's safer. We got the therapies. It's a younger demographic. No, 21 fatalities in the last day alone. Pay attention to that. The next chart is an eye-opener. You maybe remember when it was just a few towns in eastern Connecticut. Now it is, virtually all red. Maybe Bridgewater or Berkhamsted, you'd like to go because that's one of the last of the places with very few cases. I think what this reminds me of is why we know that doing whatever we do on a statewide basis is much more effective than doing it on a municipal basis. And by the same token, what we do on a regional basis with our neighboring states, which are getting as red as Connecticut, is much more effective than what we do by ourselves just for the state of Connecticut. So we keep that in mind as we focus on what we're trying to accomplish here. Briefly speaking, that's 96% of the people in Connecticut are in this, are red. 15 cases per 100,000. Maybe you say that's because we do a lot of testing. And it's true, we do twice as much testing. Even if you divide by half, we still have, we'd still be in the red. It's that level of infection and community spread. So what are we doing about that? First of all, as I mentioned to you, next chart, Max, what I've said is our real priority right now is working on a regional basis. So we, the governors, all got together virtually over the last, 5 days and set in place some priorities of what we want to do working together. First and foremost, we said the next change that will kick over the hornet's nest is Thanksgiving. Thanksgiving because we have thousands and thousands of college kids coming back home. As I've said before, many coming from high infection areas, much higher than Connecticut, New York, and Massachusetts. So what we've said and put in place very strict testing protocols and quarantine rules for all those kids coming back to Connecticut. And by the same token, all the kids leaving Connecticut and going back home will have similar testing protocols. And we've reached out to all the universities around the country saying, this is what we're doing to keep your community safe. I hope you show the same respect and do the same for your students returning back to the great state of Connecticut. High school is increasingly going hybrid, and we can understand why that is. And K through 12, still a majority, or K through 8, a majority of those schools are still in person. And one of the things all the governors in our region did as part of our declaration was there's no substitute for in-person learning as long as you can do it safely. There's no substitute for it educationally, There's no substitute for it in terms of mental health. And there's no substitute for it in terms of public health, in the sense that we still believe that being masked in a third grade classroom is much safer than being out there in the broader community. That could change on a regular basis, but we're watching that carefully. So a lot of what I'm going to talk about now is what we're doing to try and keep your schools open as long as we can. And one of the things we've done with our track and trace, one of the things we found with our cellular analysis is that many of the infections are related to sports. You'll see on this graph, there have been 17 school closures due to sport teams, high school sports teams, 29 outbreaks attributed to sports teams. 235 teachers had to quarantine due to a sports team member. Ellen, look, she's mayor of Bristol. Bristol is the home of ESPN, and she'll tell you how high school sports and club sports have impacted the schools in her town. We'll do that just in a minute, Ellen. So what do we do about that? How can we try and limit the spread as they related to sports team? Here we're going to be strict. Next graph. Number one, I salute the Athletic Association, Interscholastic, saying we're going to postpone all high school winter sports, not starting until January 19th. I know how tough that is to families. I know what you're looking forward to, but we've just seen too many infections in and around those winter sports. Not necessarily on the ice, but everything up to the ice, the travel there, locker room and the such. And there we have to err on the side of public health. This is the best way we can keep your schools open a little bit longer. Secondly, that's it in terms of club sports as well. They're going to not be allowed to reopen until January 19th as well. I think you understand for the same reason, perhaps a younger demographic, but again, an effort to keep those schools open as long as we can do it safely. And that will be effective on Monday, November 23rd. Okay, well, how come this doesn't apply to professional teams? How come this doesn't apply to college sports? As I've tried to explain before, at least the colleges and the professional, they can operate within a bubble. And that means that, UConn basketball, they're eating, they're taking classes, and they're doing sports together, unlike high school where you go back to school at the end of the day or at the start of the next day. So it's a very different infection ratio. The other thing we talked about as governors and why November is such a complicated month is retail and Black Friday and leading up to the holidays where this is the most important 5 weeks in retail shopping. We believe that some things are very risky to do as the infection rate goes up. Obviously, bars is one. We're watching restaurants carefully. But we do believe that retail can be done safely. But retail only works if it's being done safely. So I spoke to the Retail Association this morning, and they said, please don't hold us accountable for a few bad apples. And I said, look, we can't do all the enforcement ourselves. I want you to look out for those same folks that maybe aren't respecting the 50% maximum capacity, aren't telling people to wait outside because it's too crowded inside the store right now. At the big shopping mall where everybody maybe congregates in the common areas in the middle and having something to eat. If you're not patrolling that, monitoring that, and keeping the 6 foot of spacing, we're going to have a hard time keeping retail open. So we're doing everything we can to keep retail open, especially during this most important of seasons. And of course, as always, that starts with the masks. So the next chart is just some of the things for you to think about so that we can keep retail going. Plan ahead. Plan ahead for lines if you have to wait outside a little bit. Maximize curbside pickup. I think more and more stores are doing that. Saves you having to go in. Stores should consider additional staff and security as needed so you can help patrol and monitor what we're doing. And flexible hours. And flexible hours, especially for our seniors. And here we go again. It's really important that seniors stay close to home. It's really important that if you have to go shopping, maybe you segregate a special hour in the morning just for seniors. It's really important that you love grandma and grandpa. This may not be the ideal Thanksgiving for them to come home, especially if you have young kids. I'm afraid we're going to have to be strict on our nursing homes. Most of our nursing homes now do have an infection. That wasn't the case. Not outbreaks, but infections. Don't go visit right now. Do not go visit right now. It is so much safer. Find other ways to FaceTime, ways that you can stay in contact. But if you want to keep your loved ones safe, that's our strongest recommendation going forward. Finally, let me just say something about enforcement. This only works. We can only keep our economy open to the degree to which it is open. We can only keep our schools open to the degree to which they are open if we pay attention to the protocols and the rules we got out there. And 90% of that is related to you. 90% of that is related to self-enforcing. I can tell you, have small Thanksgiving. I can tell you, keep to your closest family. It's not that easy for me to enforce that, so I really have to count on your good judgment there. That said, there are some things that are being enforced at the local level. We're enforcing mask rules. We have fines for parties. And in fact, Michelle may talk a little bit about liquor licenses and Bristol Sports and some of the ways she's doing everything we can to keep our economy going by making sure those outliers, those bad apples, don't ruin it for everybody else. Michelle?
Hi. So thank you, Governor. I'm Michelle Siegel, Commissioner for Connecticut's Department of Consumer Protection. And I want to begin by following along what the Governor is saying. And the vast majority of our businesses are doing the right thing. They are following the executive orders and the sector rules. That being said, the Department of Consumer Protection, we do have an ability to immediately suspend a liquor permit if we recognize that there's public health, welfare, or safety are at risk. And certainly the governor's executive orders, the DECD rules, they're clearly designed to protect public health. And so when we're learning of significant violations there, we do see an immediate and serious risk to the public health of our communities. It's not something we do lightly, but we know our towns and our communities, our local officials are working really hard to enforce these rules and to keep their communities safe. And so we're happy to do our part at Consumer Protection. And when somebody who has a permit from us and we are giving the right to serve liquor, is violating those rules, putting their communities at risk. We really want to be supportive of those local officials and to do our part to support those efforts. Another brief thing I want to talk about, since I am Consumer Protection, is we've become aware that some people are a little concerned in taking calls from contact tracers. First, want to emphasize it's really important to take those calls, work with these legitimate contact tracers. It's how we're all staying safe, how we're helping to reduce the spread. So a couple of tips so you can know that you're dealing with someone who's legitimate. If they're a real contact tracer, they're not going to ask you for money. They're not going to ask you for a bank account, credit card, or social security number. And they're not going to ask about your immigration status. So you should feel comfortable, take these calls, work with those people, and know you shouldn't be asked for that type of information. So again, thank you, Governor, and we look forward to continue working with our communities and keeping everyone safe.
All right, Michelle, you didn't know what you signed up for when consumer protection. Your job definition has gotten a lot broader, and so is yours, Ellen. I mean, I'd love to hear your point of view. As a mayor, that's where the rubber meets the road. We're putting in place some of these rules. Do they make sense? Are they enforceable? Are they making a difference?
They are making a difference, Governor, and it's very helpful when it's taken upon as a regional approach or through the sector rules. I can tell you here in Bristol that since September, we have had 342 Bristol students miss school because of COVID exposures related to club and youth sports activities. So we are definitely seeing an impact, and right now that, as well as bar and restaurant use, as well as family gatherings, bridal parties, weddings are our leading indicators through our contact tracing. So anything we can do to work together to make sure that all of these are enforced, I think is going to be very helpful for us to keep the kids in school, to keep people conservatively shopping and supporting our local businesses, but also giving us the tools that we need to ensure that everybody is playing by the rules, because that's the only way that all of this succeeds.
Well, thanks. Ellen and Michelle will be staying on, as well as Paul and Josh, for your questions.
Reporters, please remember to keep yourselves muted even during the conversation to prevent echoes. We will start with NBC Connecticut.
Hi, Governor Matt Austin with NBC Connecticut. Today, Rhode Island rolled out new upcoming restrictions. New York Mayor de Blasio says indoor dining and gyms could close within weeks. What is your possible timeline for further restrictions?
I think Rhode Island, caught up with us in terms of some of the rules as regards social gatherings and the such. We're in close contact with Gina. Matt, what else are you referring to?
Mayor de Blasio in New York City he laid out a timeline for possible closures for indoor dining and for gyms within possibly, he said, a week or two. Is that a time frame that you'd be looking at also?
Well, subject to the metrics, as you know, I'm trying to do everything I can to keep restaurants and gyms open. I think one of the more successful things we did in terms of enforcement was saying restaurants after 10 lights out. And, Ellen will tell you that makes enforcement a lot easier. You're not seeing how many people are at a table. You're not seeing whether, buffalo wings are being served along with the drinks to make it a restaurant. So I think we'll see whether that works. But if it's not working, we're going to have to make a change. And we'll do that in association with Governor Cuomo and Governor Baker.
And I know you had said previously that kind of a key metric for you is the number of hospitalizations. Is there a certain number or a capacity that would trigger further changes?
It's not an absolute number, but it's really the rate of change. And I got to confess, Matt, the rate of change has gone up quite a bit. And as I look in San Antonio and North Dakota, I see that they have been, really stressed. So that will force us to make changes when the time is right. That said, we got better than 50% capacity right now, and Josh is in almost daily contact with the hospital executives.
Okay, thank you.
News 12 Connecticut. Channel 3 Eyewitness
Good
News.
afternoon.
Go ahead.
Good afternoon. In terms of, Governor, you're saying the honor system kind of for Thanksgiving. I guess, how do businesses and companies respond the Monday after Thanksgiving if they found out, Susie had 20 people over? The response going to be the following week and the 2 weeks after?
Look, if Susie had 20 people over for Thanksgiving, go get tested, first and foremost. Obviously, you shouldn't have done that, and you're putting your fellow workers at risk there. I think I'd leave it at that for now.
I would just add as a reminder to everyone that, individuals who violate the gathering restriction sizes are subject potentially to significant fines, as well as the people who attend those events. So local law enforcement does have options to investigate and issue fines in those types of circumstances. But look, most importantly of all, we just need people to take this Thanksgiving off and follow the rules. This is such an important time for our state to bend this curve and get these numbers back under control. Otherwise, we're going to be faced with increasingly difficult choices about how we manage this pandemic going forward. So we're really counting on the people of Connecticut to step up, as they have done so many times through this pandemic during this holiday season.
Yeah, well said.
Channel 3 Eyewitness News.
Yes, Governor, actually just kind of following up on that Thanksgiving question, AAA released a survey. It shows 89% of our residents do not plan to travel. If that number holds true, what impact do you think that will have on our infection rate?
Well, I think, first of all, it's good news. CDC just today said stay home this Thanksgiving. Don't travel. That will lessen the risk. The closer you stay at home, especially your parents or grandparents stay at home, the safer it is for each and every one of you. Will that be enough? No, but it's an important start. Keep your Thanksgiving group small. Keep it to your family. That means next Thanksgiving could be really good.
And a question about phase 2.1. I'm wondering about the powers on the local level. For example, New Haven's mayor, he's indicated that he'd like the city to go back to phase 1 if possible. So what decisions can municipalities make at this point?
Right now, they have jurisdiction in terms of schools, since schools are fundamentally local, and people don't travel to and from the cities to go to a different school necessarily. When it comes to restaurants and everything like that, it's so much more effective and meaningful to do that on a statewide basis. So we're going to stick with that. And as you know, I'm talking to our fellow governors about what we do on a regional basis, which is even more effective.
And my final one, really briefly, just looking for clarification on the high school sports. Does this pause on sports apply to rec leagues or private sports teams as well?
Yes, but do you want to talk to that, Paul?
Yeah. I think the simple answer for you, Matt, is it's yes. It does apply for those sports, and we'll have more particular guidance for everyone in the coming hours when we post it on the Department of Economic and Community Development's website.
News 8. News 8.
Thank you, Matt. Gentlemen, Paul and Governor, I know you talked a little bit about what's going to happen with sports, or what can't happen with sports, I guess, is probably more accurate right now. It just seems to be there are so many numbers that pile up on going against anytime soon, any games being played. Do you think it's even realistic? I know a lot of the things in high school have been pushed to the spring, but if you had to guess right now, do you think there's really realistically any chance of that happening?
Rich, we're going to sure try. I mean, I know how I love sports. We're all in high school. I know how important that is for young kids. I know a lot of them have been gearing up for this for a while. Even if it's an abbreviated season that starts later, that's worth it as long as we can do it safely. We'll see where we are in the therapies. We'll see where we are in the vaccines. You like to think by the middle of January, late January, making some progress there.
You did allude to, obviously doing everything you can for the kids to stay in school and so on and so forth. And you did touch upon, there has been some talk about the non-essentials maybe at some point after Thanksgiving, and someone even came up with a 6-week thing. So as far as you can tell right now, is the plan right now to just kind of stay the course and then react to it from there?
Well, when you say non-essentials, are you still talking about schools? Because to me, a third grade classroom is essential. A third grade teacher is essential. A third grade para is essential. Third grade food service worker who provides food for kids who otherwise may not get a meal. They're all essential. I'm doing everything I can to keep them safe. I'm doing everything I can for that kid that he or she has at least the opportunity to go to the classroom.
Fox 61.
Hi, Governor. I know 2 days ago you mentioned no lockdown for Connecticut. Is that stance still the same? If so, why?
Because I want to do things that work. And I don't want to, so as I started out by saying, I think retail, we can operate that safely as long as people follow the protocols. K through 8, in particular K through 5, I think we can keep those schools open and do it safely, and I know what it means. So it's not going all the way back to where we were in the spring when we dropped the boom. We had an outbreak that was raging. We did everything we could. Now I think we have a more refined response that allows us to deal with the COVID in a serious way and yet allow our kids still to get educated.
WTIC 1080 News.
Hi, leaving the feds out of it because Congress has now gone home for the week and the Senate didn't do anything for folks as far as a further bailout. People are losing their homes, losing jobs and all that, as we know. How bad is this economy going to get? And can the state, without any help from the Fed, it doesn't seem to be forthcoming, can the state do anything more to help?
Oh, yeah, but we really need the federal government to step up. I mean, this state, this country could be plunging into a really deep recession that really impacts small business, really impacts families, really impacts unemployment, not to mention our state budget, which takes care of a lot of people in need. That said, we're in relatively better position than a lot of our peers because we do have a rainy day fund. So if it takes Washington another couple of months to get their act together, damn it, we're prepared to step up, do what we need to do out of the rainy day fund in terms of vaccinations and testing and track and trace so we can continue to keep our people safe. But I can't bail out every business at the same time. I need help from the feds on that.
Josh, any projections we should know about of how bad or maybe better the economy can get before there's a vaccine?
The projections I see is the COVID infection rate peaking sometime in January. What I see is we'll be able to take care of some of the frontline workers and some of the most vulnerable in January, but not enough to protect the economy. So we are going to need a bridge to that time when we have a vast majority of our population vaccinated and our economy back at full throttle.
The Connecticut Mirror.
Commissioner Siegel, how many liquor licenses has the department suspended due to COVID violations?
It's just been the two that have happened recently.
And are these all based on referrals, or have you redirected any of your inspectors to basically going out at night and looking for crowds?
These have been based on referrals. And, so we do have inspectors working on this, kind of going out. But, we spent a good part, especially towards the beginning and when things were slower, really educating businesses about the rules, trying to get people in compliance when we got a complaint. Now, as things are getting worse and when we're getting these very specific referrals where, a police chief or a director of local health says our community is really at risk because of this activity, that's where we've realized we need to step it up to the next level and really take more aggressive action and send a message that these rules are serious and we need to be following them now.
And you gave us tips on what to look for on legitimate calls on contact tracers. Have you got complaints about scam calls, people posing as tracers?
We haven't specifically in our complaint center been getting complaints from people who have lost money yet from that, but we are starting to hear just through, through our various contacts, we're getting shown stuff on social media where there's definitely that concern out there. And it's so important, often I tell people, oh, don't pick up the phone, but it's really important that you take these calls, that you work with these contact tracers. So I do want to just make sure people know, okay, this is the information you shouldn't have to give out so people can feel comfortable doing that.
Thank you.
The Associated Press.
Good afternoon. Governor, you talked about the increased testing capacity. We're hearing about lines and seeing wait times of over 2 hours in a lot of places, people not being able to make reservations for the next week because they're all filled up. What more can be done to get the lines down so that people actually feel like they can go out and get tested in a reasonable amount of time?
Well, again, we've added 60 locations. We're doing, 20 times more testing than we were just a few months ago. But I understand people's anxiety. It's a good thing. They now want to get tested. A few months ago, we had to, go out and convince people to get tested. We're trying to make it easier to get tested at schools. Obviously, we had the Binax test at colleges. We're getting that to schools as well. Josh, how else can we make it easier for people to get tested?
Yeah, with the governor's support, we're working with our testing partners across the state to expand their hours of operation, to add lanes, to make sure that we are staying open on the weekends as well. And we know that many of those testing partners are hiring aggressively now to expand capacity, so there are job opportunities there. And in the meantime, we've also deployed 50 members of the National Guard to help where we do have some staffing shortages. So we ask for people's patience and also want to take the opportunity to thank all of the people running those testing sites out in the community, the nurses, the administrators, It's cold out there now. They've been doing this for a long time. They're getting tired. They're taking abuse from some people who are waiting in line. So I encourage everyone to actually express their thanks to those folks who are out there every day trying to help protect us and execute these tests.
Thanks, Josh. And Governor, could you address the prison saw a death yesterday for the first time in months? And if you look at their site, they haven't been updated in a few weeks, but it looks like there might be an issue at Osborne as opposed to some of the others. What do you know about what's happening in the prisons, and is there any concern there?
Well, there's always a concern. There's always a concern wherever you have a congregate setting. Fatalities and infections are ramping up at nursing homes, and I wouldn't be surprised to see something at our correctional facilities as well. I want you to know that it's been 7 or 8 fatalities in our correctional facilities, which are 7 or 8 too many, but much lower than the general population, much lower. And that's because our amazing correctional officers are doing everything they can to keep people safe there in terms of disinfectant, in terms of wearing the mask. And can they do better? Yes. Are they doing pretty well? I hope so.
Thank you very much. Appreciate it.
Hartford Current.
Hey everyone, this is Emily Brindley from the Current. Governor, you have talked in the past about the European model of trying really hard to keep schools open. But in a lot of European countries, they also have closed their restaurants and gyms, which is something that you said just on this call that you don't want to do. So what are you willing to close down in order to keep schools open? Because right now it sounds like you're kind of leaning toward just keeping everything open.
Well, I would say that the universities are going home and not coming back for a few months. I'd say if you're a high school coach, you're not overjoyed that your season's not going to start until January 19th. I'd say that if you like going to a restaurant after 10 o'clock at night, you kind of think we're a little bit restrictive there. So I don't know about everything wide open, but I think generally speaking, what we are trying to do is when it comes to gyms and restaurants, look, we're watching them carefully. It's much more effective if I do that with Charlie Baker and, Andrew Cuomo. We're talking about this. We're following. We hope that 10 o'clock limit will make a difference. We hope that they will self-police and self-enforce very carefully, because we know that in a restaurant where you have to take your mask off to eat, there is some risk there, no matter how safe you're doing it. If I have a 5% infection rate, a 6% infection rate, and there are 50 people in a restaurant, that means 3 of them are infected. And you can put up plexiglass and anything you want. If somebody sneezes, you've got a problem. And I can't outlaw sneezes. So we've got to be very careful about how we allow these things to stay open, leading with public health. So you're right. We're going to take a look at that.
So can you kind of give me a rundown of the order of when things would be closed? Because you've said that you want schools to be closed as a last resort, but then you also said that you want gyms and restaurants to stay open. So what gets closed before schools get closed?
Oh, look, if I looked at a risk continuum, I would say, gyms and indoor dining is something I have to look at carefully, because that's relatively more risky than, say, retail. Which I think we can probably keep open more safely. I'd say high schools are relatively more risky than K through 5. That's the extent of my thinking right now on that.
And one last thing, you were asked earlier about Rhode Island's restrictions, and they actually today rolled out some pretty intense restrictions, including prohibiting all gatherings outside of households. Is that something that you have considered doing? In addition, they also did a 2-week pause on a lot of businesses. So are you considering following suit there?
Well, remember, that's not going to take place till after Thanksgiving. So we are watching that. Look, my strong recommendation is if you're having Thanksgiving, do it with just your immediate family members. I can set a rule. I can set a law. I can pretend we're going to have fines. That's meaningless. But you know what our strong guidance is. Stick to your family cohorts. I know it's kind of exhausting. You've been through this before, but we're all going to get through this a lot faster if you stay strict now.
So just to clarify, you're planning on keeping the gathering rule guidance. You're planning on keeping that as guidance, not as rules, as far as not seeing people outside of your household?
That's right. I think that's right. It's strong. Look, it's what I can enforce. And so stick to your family, that's for sure. And gathering size is no more than 10.
Thank you, Governor.
Thanks, Emily.
Hearst, Connecticut Media. Hearst, Connecticut Media.
Hey, Governor, sorry about that. Looking back over the pandemic now, we're about to hit 100,000 cases. And looking back over everything that's happened, is there anything that you would have done differently or anything you think we could have done better?
I would just tell you, back in March, April, we were just drinking from a hose. Nobody had the PPE. There was no stockpile in Washington, D.C. There was no testing. We had to do testing out of someplace in Atlanta. Oh, no, that we can test, and it's got to go to California. By then, it was 5 days later, and a lot of bad things happened in 5 days. So I think in hindsight, if this country had a chance to do things differently, it'd be very different. The only good news is, I can tell you, is this time around, we are much better prepared. But that said, I see the COVID cloud. It's coming in from, first it was North and South Dakota, then Wisconsin, Michigan. Now it's Western Pennsylvania. And we're doing everything we can to protect ourselves. We'll see.
Thanks. And then specifically on the vaccines that we're seeing in development, what's going to be the state's role in terms of rolling those out? Are they actually going to be having doing transportation or distribution of those to populations? And what about people without insurance?
Yeah, my understanding is that Pfizer and Moderna, working with perhaps McKesson, are going to get the vaccines distributed to hospitals, to nursing homes. We're working with CVS. We're working with Walgreens. We're working with Stop and Shop. The hospitals have sub-freezing refrigeration. Other places it'll arrive in dry ice where it can be kept cold enough, long enough that we can get those vaccines out. And we're going to be training people to make sure we have the people in place to get the vaccines administered as needed and tracked as needed. Josh, anything else on that?
Just on your point about people who may not have health insurance, fortunately, it's not a huge number of people in the state, but regardless, this vaccine is going to be free to everyone. So there will be no cost requirements for anyone to get vaccinated.
Thank you.
The Waterbury Republican American.
Thanks very much. I have a question for Mayor Zappos. How is the state doing? How would you rate the state's? How would you rate this? How the state is communicating to local governments, especially when guidance changes? For instance, when the gathering limit went from down to 10 people on November 6th.
We really have no complaints. Things have been going very smoothly based on the level of communication that happens. We meet, it was for a long time, it was weekly with our governor's calls with the municipal CEOs. And so that was very helpful as both a preview as well as just an open forum so that we could talk about things that were coming down the pike. Meanwhile, a lot of the state agencies have also set up similar types of communication portals. So we have one with the Department of Public Health. We obviously do with the Department of Education. So in all of those types of scenarios, we've been on the ground running, knowing what's coming ahead of time. We've also emulated that type of communication network locally so that we meet weekly as well with our department heads so that we can again triage what's happening. Our Bristol-Burlington Health District has been at the forefront of coordinating a lot of these resources, and it's been going really well. Likewise, we've been talking to other towns around us, and so we've really kind of created a network. So I would grade it as excellent, and it's been very helpful in order to have all of these communication networks available to us because it helps us do our jobs easier. We're able to coordinate testing sites. We're working with federally qualified healthcare centers. We do have a hospital in Bristol. We're working with our superintendent. We're working to set up childcare at some of our nonprofits in order to support parents that are still working for those days that are hybrid learning. So overall, having kind of the heads up, so to speak, has allowed us to be very versatile and pivot from one issue to another as they've developed.
And maybe Josh and Paul can explain to us exactly how this works. How do you communicate with local health departments, local police departments?
Well, I'll start and I'll let Josh do it because he basically runs our municipal calls. One, our local DPH, led by DJ Gifford and her team, they speak to local health departments on a daily and weekly basis, daily in terms of individual, weekly as a full group. And that allows for full information to be distributed about what decision-making the state is making, what's coming down the pike, what are trends. The reason why we're able to even make this decision as it deals with youth sports is because of that collaboration with local health directors who provided information based upon a survey put out by DJ Gifford that the governor spoke about earlier today. And I'll let Josh talk about just our municipal calls and what we do on that basis.
Sure. Just briefly, probably important to point out that the unified command structure, which is our long-established structure for dealing with crises, usually hurricanes or snowstorms, we activated the Emergency Operations Center back in February, and we haven't shut it down. We've been meeting throughout the entire summer to prepare for the anticipation of a second wave, as we're experiencing now. And that framework helps connect us into our municipalities through the regions and the municipal emergency response coordinators. But as Paul was mentioning, in addition to that, we have regular calls with our functional counterparts, so in public health and emergency services and public protection. And the governor hosts regular calls with mayors and first selectmen and their staff to answer questions and keep the lines of communication wide open. And we really appreciate the tremendous partnership of the mayor and all of her counterparts around the state who've been such important partners in our response.
And I got to guess this question for the governor. It seems that there's large swaths of Connecticut that don't want to follow these coronavirus rules. Another large swath that wants to see the violators cracked down upon in the most severe way possible. What's it like trying to lead the state through this pandemic when you have these sort of opposing camps or opposing schools of thought in the state among the people?
I'd say, Paul, the other 90% of people want to do the right thing. And I think the vast majority of Connecticut knows that if we wear the mask and keep our distance and follow these rules a little bit longer, it'll make a big difference. And I think as I look at North Dakota and Iowa and a few places that said, oh, masks are for wimps, I think people have come around to what we got to do to keep safe, even in the reddest of states. So I think Connecticut's doing it right.
Okay, and just one last question for me. What's the current 7-day rolling average in terms of positive percentage of tests?
5.8, I think.
That's correct.
Thank you.
The Day of New London.
Hi, Taylor Hartz here from The Day. Where are we at in terms of contact tracing numbers? What percentage of people who test positive are we reaching with tracers, and how has that number, increased with the rollout of the app, the smartphone app that tracks exposures?
Over to you, Josh.
Sure. Thank you for the question. First of all, important to remind that traditional contact tracing and the app are two separate processes, so they are complements to each other. With regards to the main contact tracing process, where local health finds out about a case and then they call that person and interview them to find out about their contacts, and then contact those people and encourage them to quarantine and get them supports that they need. We're reaching out to almost 100% of the people who test positive within 48 hours. Our teams continue to do a tremendous job getting quickly out to those people. We're finding that about 2/3 of the people that we reach out to do engage in that conversation and are willing to be interviewed. So the teams are doing really well. And even as the cases are ramped up, the process we built is very scalable. We've got great partnership with our local health departments, and we created a surge capacity team at the state level to step in if a local health department gets overwhelmed or falls behind. So process has been working very well. And the complement to that is the app, which again, we'd encourage people to sign up for at COVID Alert CT, ct.gov/COVID Alert CT. And that simply is an anonymous tool where if you have been in close contact with somebody who tested positive and they enter a code into their phone, if they've opted in, then you'll get a notification like you would any other notification on your phone warning you that you've been exposed and giving you instructions about how to isolate. But that notification is completely anonymous. It won't say who tested positive. It won't say where you were when it happened or what day it was even. It will just give you that information that you can then use to help keep yourself and your family safe.
And are we still growing that contact tracing workforce and volunteer force, or have we kind of steadied out on that?
No, we've continued to grow it in anticipation of continued case growth, wanting to constantly stay a couple steps ahead and make sure that we have excess capacity to meet the need.
Thank you.
You're welcome.
CT News Junkie.
Thanks. Governor, I'd like to talk for a second about the transportation fund. After the election, you stated that you did not intend to pursue tolls again this year and suggested you might be proposing other alternatives. What alternatives are you considering?
I'm going to sit down with the transportation chairman and the legislature in terms of what we do about the transportation fund. As you can imagine, it was drained a lot over the last year. Many fewer people driving, gasoline prices an all-time low, and we've got a lot of infrastructure work we got to do. But look, I led last time. I told you a way I thought we could solve it. Wasn't that popular, actually. So this time I'm going to present some options to the legislature and see if they're willing to bite on something that actually pays for itself and works.
Interest rates are real low right now. Are you considering borrowing to fund the transportation fund?
Look, I don't love that idea, Hugh, because that's what we always do in this state. We can't make up our minds, so let's borrow some more. That said, interest rates are at historic lows. This is the time to be making long-term investments, so borrowing will be part of our strategy, yes.
And what sort of help do you think we might receive federally with the Biden administration coming in?
Let's go. Hurry up. My strong feeling is when it comes to infrastructure, there'll be some bipartisan support, and President-elect Biden has a way of being able to work across the aisle and hopefully get something done. Nobody can just say no. When it comes to the supplemental for our small businesses and state and local and the vaccinations, I got to believe there'll be a consensus. Maybe not everything the Democratic House of Representatives wanted, but enough to get the job done. Our economy is really at risk and our health systems are at risk. We need that help.
Earlier this year, you kind of declined to commit to the Transportation Climate Initiative that sort of raises gas prices. Other states are considering it. Have you given that any more thought? Where do you stand on that now?
It's something a lot of the regional governors are thinking about, and one of the ideas that I think the legislature ought to be thinking about.
Where do you stand on it, though? I mean, would you, if let's say they did endorse it, would you be open to that?
Look, I'm sympathetic to realistic ways that we can fix our transportation system because it's key to our economic future. And that's one of several options the legislature's got to consider.
Okay, one last thing. You tweeted a picture. It appears you were talking to President-elect Biden this week. Care to share any of the details of that conversation?
I wouldn't say it was a conversation. He was talking to a whole bunch of us who were early supporters, and it was personal, as personal as you can be, talking to a few hundred people, just what it meant to him, because when people came out early for him, there were a lot of tough times ahead, and remember he lost some primaries bad and wasn't raising any money. He just said, I remember my friends, and I appreciate what you guys did standing up early for me. That's all he said.
Okay. All right. Thanks very much.
No more questions.
All right. Well, let me, first of all, thank Michelle and Ellen. You lend their perspective about how things actually get done and where they make a difference. And there were some questions about, do we have enough people for track and trace? Do we have enough people to do the additions and testing we've got to do? I know some schools are having a hard time with, getting apprentices in to help out in the classroom because a lot of older teachers have to quarantine. And it's had me thinking a lot about a Connecticut Health Corps. I know a lot of young people are coming back. Colleges are closing down. And I don't want you just sitting around for the next 3 months waiting to see if things get better in February. We could use your help. We're going to create a website where you can invest your time and energy, track and trace apprentice teachers, testing, things like that. We have a bit of a fire on our hands, and the more people we have in the bucket brigade, the safer it is for each and every one of you. And we could use your help. That's how we're going to win. Thanks, everybody.